Every year, millions of seniors across the United States review their Medicare Advantage options, and 2026 is shaping up to be one of the most unpredictable years yet. Between plan changes, new regulations, and insurer shakeups, many people are asking, which Medicare Advantage plans are actually the best for seniors over 65 this year? If you've been wondering the same thing, you're in the right place, because today we're ranking the best Medicare Advantage plans for 2026, from number 10 all the way to number 1. Before we jump in, drop your first name and the state you live in down in the comments. I want to see who's watching, which states are the most active, and how many of you are planning your coverage smartly for 2026. Now, let's get right into it, because some of the results this year might surprise you. At number 10, we have WellCare. Over the past few years, WellCare has tried hard to compete with the big players like Humana and Aetna, but 2026 hasn't been an easy ride. Their customer satisfaction ratings have been mixed, with complaints about provider availability and prescription drug coverage in some states. According to the latest CMS data, WellCare's average star rating sits around 3.5 stars, slightly below the national average. The company does, however, offer some of the lowest premiums in markets like Florida, Texas, and Nevada, making it appealing to cost-conscious seniors. But here's the trade-off: lower premiums can sometimes mean fewer network options and stricter referral requirements. In short, WellCare is budget-friendly but may not be ideal if you prioritize flexibility and provider choice. Coming in at number 9 is Cigna. Cigna has been working to strengthen its Medicare Advantage presence, but 2026 hasn't brought as much expansion as expected. Some plan members have praised Cigna's telehealth services and wellness perks, especially for seniors managing chronic conditions, but overall, its availability remains limited to certain regions. In terms of star ratings, Cigna's Medicare Advantage plans average around 3.7 to 3.8 stars. The company's biggest issue continues to be limited reach. It simply doesn't have the nationwide footprint that competitors like Humana or UnitedHealthcare can offer. Still, if you live in states like Arizona or North Carolina, Cigna might deliver solid coverage at a competitive cost. At number 8, we find Anthem Blue Cross Blue Shield, now rebranded under the Elevance Health umbrella. Anthem has a long history of strong benefits, but 2026 has been a year of adjustments. With changing reimbursement rates and updated CMS rules, Anthem has had to pull back some of its extra perks, like vision and dental benefits, in certain markets. That said, they continue to score high in care coordination and preventive services, with most plans rated 4 stars or higher. Their new focus on coordinated care through partnerships with local providers means that seniors who prioritize long-term health management, not just short-term cost savings, might still find Anthem a good fit. But overall, Anthem's performance is solid yet cautious this year. Now, at number 7, we have Kaiser Permanente. Historically, Kaiser has dominated the Medicare Advantage landscape in states like California, Oregon, and parts of the Mid-Atlantic region. Their integrated care model, where your insurance and healthcare provider are part of the same system, continues to deliver some of the highest satisfaction scores in the industry. In fact, Kaiser's average star rating is an impressive 4.9 stars, and their clinical quality metrics remain exceptional. So why aren't they ranked higher? Because Kaiser's reach remains very limited. If you don't live in a Kaiser-served area, you simply can't enroll. This limitation keeps it out of the top 5, but for those lucky enough to live in their coverage zones, Kaiser continues to be one of the best managed, most efficient Medicare Advantage providers in America. At number 6, we have Aetna, one of the most consistent performers in the Medicare Advantage space. Aetna's 2026 lineup remains strong, with many of their plans offering $0 premiums, low maximum out-of-pocket costs, and broad prescription coverage. What's made Aetna stand out this year is its increased investment in chronic care management and mental health support, 2 areas that seniors have increasingly valued post-pandemic. In addition, Aetna's star ratings are trending upward, averaging 4.1 stars nationwide, and they've expanded their PPO options, allowing seniors to see out-of-network providers more easily. The company's integration under CVS Health continues to add strength to its pharmacy network, making it one of the most convenient plans for seniors who value both affordability and access. Moving into the top 5, at number 5 we have Blue Cross Blue Shield, BCBS. With multiple affiliates across different states, BCBS plans can vary a lot depending on where you live, but overall, their Medicare Advantage programs have gained serious traction in 2026. Some of the most notable improvements include expanded telehealth access, enhanced preventive care programs, and strong star ratings averaging 4.2 to 4.3. However, what really stands out is BCBS's focus on local partnerships. They've been teaming up with community hospitals and clinics to improve access and reduce wait times. For seniors living in more rural states like Montana or Iowa, that's a big win. BCBS isn't the flashiest option on this list, but it's one of the most dependable. At number 4, Molina Healthcare surprises many people. Traditionally known for serving Medicaid populations, Molina has steadily expanded its Medicare Advantage presence and is now one of the fastest-growing insurers in 2026. Their competitive edge lies in offering low-cost plans with generous supplemental benefits, especially dental, vision, and over-the-counter allowances. Molina's star ratings hover around 4.0 stars, but their growth rate and improved member satisfaction have put them in the national spotlight. They've also made major moves in Texas, Florida, and California, where they're competing head-to-head with established giants. The catch? Network size is still limited, but that's changing fast. At number 3, we have UnitedHealthcare, UHC. Now, this one is interesting. Despite being one of the biggest Medicare Advantage providers in the nation, UHC has made headlines in 2025 and 2026 for exiting certain counties and reducing plan availability to focus on profitability. But here's the twist, even with those changes, UHC still serves over 7 million Medicare Advantage members nationwide and maintains an average 4.2 star rating. Their Part D integration, robust wellness programs, and massive provider networks still make them a strong choice for many seniors. However, the strategic exits have affected perception, and that's why they've slipped from the number 1 spot in previous years down to number 3 in 2026. At number 2, we have Humana, and this year, they've made a big comeback. While other insurers scaled back, Humana doubled down on expanding their Medicare Advantage offerings. They've maintained an impressive average star rating of 4.3, rolled out enhanced dental and vision benefits, and improved their chronic condition management programs. What's also new for 2026 is Humana's focus on value-based care, which means they're rewarding doctors for better health outcomes rather than more services, a shift that many experts believe represents the future of Medicare Advantage. Humana's premiums remain low, and in some states, their HMO and PPO options come with $0 premiums and generous drug coverage, putting them near the top for overall value. And finally, at number 1, the best Medicare Advantage plan for seniors over 65 in 2026, goes to Devoted Health. While it may not yet have the scale of Humana or UnitedHealthcare, Devoted Health has earned top marks for member satisfaction, customer service, and quality of care. Their average star rating is a staggering 4.8, and their growth rate over the last 2 years has outpaced nearly every other provider. What's truly unique about Devoted is their personalized approach. Their care guides and tech tools help seniors navigate appointments, medications, and benefits seamlessly. They're also expanding into more states this year, including Arizona, Georgia, and North Carolina. For seniors who want a mix of technology, human touch, and affordability, Devoted Health stands at the top of the 2026 rankings. Now, it's important to remember that the best plan always depends on your personal situation, your medications, your preferred doctors, and your budget. These rankings are based on official CMS data, star ratings, premium comparisons, and real user feedback from across the country. What matters most is choosing a plan that meets your needs, not just the one with the highest score. And as always, if this breakdown helped you understand the landscape better, stick around, because 2026 is bringing even more changes to Medicare Advantage, and we'll keep covering them right here, in detail, to help you make smarter, more confident decisions for your healthcare future.